The topic of today's video is gallbladder cancer. This is a serious condition and it requires, wherever possible, for a patient to be treated by a specialist team in a specialist center. I'm an expert in the field, and that is just to reassure you. Let's look at a sketch of the organs in the upper abdomen to give you an idea of where the gallbladder is before we proceed further. On the right of a person, in the picture here depicted liver is this organ. Liver is the primary organ that produces bile. Bile is then shunted down these two tubes, which then form a single tube called a bile tube, and it takes bile down into the small bowel. Bile is important for digestion of fat. Attached to the bile tube is a sac called the gallbladder, and the gallbladder concentrates bile and squirts it down when it's needed. The direction of the flow of the bile is indicated by these arrows. Over here is the stomach that churns the food and it pushes it down. The back of the stomach is the gland called the pancreas, which produces pancreatic juice coming down this tube, which is one of the primary sources of digestion of the food. So that's a very quick background. Just one further caveat. Here in yellow are lymph nodes, and these yellow channels coming out of the gallbladder indicate the direction of lymph flow from the gallbladder. Lymph nodes are bean-shaped, really tiny pieces of tissue which are important in immunity, and it filters out any infection, but equally cancer cells can get trapped in these lymph nodes, and hence it is important in terms of cancer treatment to be aware of their importance. Now let's delve a little bit deeper into the gallbladder cancer. So before we talk about the background, let's look at this picture again. So here's the gallbladder. This is the lining of the gallbladder called the mucosa, and you can see a nubbin of growth, the gallbladder cancer, arising from the mucosa, epithelial cancer, and typically an adenocarcinoma. That's the technical name for it. Incidence of the gallbladder cancer in the US, there are 5,000 cases approximately annually. The incidence is much higher in countries with a high incidence of gallstones, such as India, South America, and especially Chile, where gallbladder cancer is particularly high, and as well as parts of Pakistan. What are the causes of gallbladder cancer? Now, the commonest causes are gallstones, and you can just think about rather large gallstones causing irritation to the mucosa or the lining of the gallbladder, and hence finally initiating a gallbladder cancer. The other is polyp, or a growth from the lining, which then progresses and turns into a cancer. Less commonly, porcelain gallbladder is a condition of the gallbladder wall which takes up a lot of calcium and becomes calcified and increases the risk of cancer. And rarely a condition called primary sclerosing cholangitis, PSC in short, and sometimes chronic infections such as salmonella as well as helicobacter have been implicated in cancers of the gallbladder. Okay, so how is the gallbladder cancer detected? Commonly it is incidental. What does that mean? A gallbladder operation is performed, the gallbladder is removed, and the gallbladder cancer is then detected in the specimen. Sometimes the gallbladder cancer becomes obvious during the operation for gallstones, and rarely, if a scan is performed for something else, the gallbladder cancer may be evident. Now, why is that? And the reason is that the gallbladder cancer is not a type of cancer that gives rise to symptoms early, and unless there are stones that cause symptoms in the gallbladder cancer itself, the symptoms are vague, maybe a dull ache, and that is one of the reasons why the gallbladder cancer presents, and in general, quite late, with symptoms such as weight loss, loss of appetite. By then the cancer has spread. Jaundice may arise if the gallbladder cancer spreads through this tube into the main bile tube and obstructing it, and then sometimes gallbladder cancers may actually present as jaundice when the bile cannot flow and the patient's skin and eye color changes to a yellowish tinge. The next stage is a thorough investigation of the condition. So let's just get into that. The first point to remember is to examine the removed gallbladder, and if the cancer was a surprise in the specimen, then it's really important that the specimen is assessed. And the reason is that the gallbladder cancer may be at the edges and some of it may have been left behind, or it may be at this end near the bile tube on the cystic duct margin, and these are important facts for the surgeon to know before attempting a reoperation. Let's just draw a gallbladder, and let's say this is the lining of the gallbladder, and let's just say that there is a tumor in the gallbladder wall. Now, the really important fact from a surgical perspective as well as prognosis is the vertical length of how far the cancer goes in, what's called the T stage, and the surgeon needs to know whether it was a T1, T2 or a worse stage when the gallbladder cancer was removed. So now we can go into the scans that are performed. So what is the purpose of investigation? And the first purpose is to see whether or not the gallbladder cancer has metastasized, i.e. spread beyond the gallbladder, in which case surgery would not be possible, which is a curative option. And once that has been solved, then the surgeon or the team need to carefully assess the scan for operability. So you've diagnosed the gallbladder cancer, and then you're looking at whether or not it has metastasized and whether it's removable with operation. So let's look at some of the scans. An ultrasound scan, the sound waves from the surface of the abdomen looking into the gallbladder, and it's a good scan to differentiate malignant gallbladder polyps from gallstones. A CT scan will stage the disease, i.e. look into the chest, abdomen and pelvis, as well as the main tumor itself, to settle these two questions that I've outlined over here. An MRI scan is sometimes required to differentiate a gallbladder cancer from other conditions of the gallbladder wall because it gives more detail. I must emphasize that a biopsy is not required for gallbladder cancer, because in attempting a biopsy will spread the cancer, and that will make the prognosis more poor, certainly if an operation is being considered. Treatment stage is reached once all the previous information is carefully assessed and the scans looked at, and if the gallbladder has been removed, then the specimen has been assessed for the depth of involvement. So let's just look at the first part of it first. Let's assume that the gallbladder has been removed and the cancer reached a stage or stage rate of a T2, which means a deeper infiltration into the gallbladder wall. In this case, an operation is indicated, and I'll explain in a little bit as to why, although seemingly it has been completely cut out, but still an operation is required. What if the gallbladder is still present and there is a cancer and it is removable? Then certainly if it is removable, then an operation should be performed. Now let's look into the principles of the gallbladder operation. This can be done either keyhole or as an open approach, and it is important that a section of the liver is removed along with the gallbladder. And I'm drawing out a section of the liver, what's commonly called segments 4B and 5 in technical terms, along with the cancer of the gallbladder. And while doing so, the surgeon ought to ensure that the cancer does not extend into the main bile tube, and if it does, then the surgeon needs to establish that he can get above the cancer and take out the bile tube along with the gallbladder at the time of surgery, so the cancer is completely cut out. Now that is removal of the gallbladder cancer, but it is just as important to remove all of the lymph nodes that I mentioned previously, what's called a lymphadenectomy. And removing all of these lymph nodes is important so that the patient gets the maximum benefit from the operation, but also the important information about whether or not the lymph nodes are involved in cancer, because that then carries a worse prognosis. So just to summarize that very quickly, gallbladder operation is conducted by specialist surgeons in liver and pancreas surgery. A part of the liver is taken out along with the gallbladder altogether, and an assessment is made at the time of surgery about the extent to how far it goes, and all of the lymph nodes are removed in the area along the bile tube and along the head of the pancreas, as well as in the neighborhood, thus ensuring that the cancer is completely removed. Now let's look into the situation where a gallbladder has been previously removed, and although the cancer has been fully cut out, the surgeon still tells the patient that the patient needs a second operation to complete the removal of the cancer. And why is that? And it is because of these lymph channels that go into this, that run alongside the gallbladder and behind it in the interface between the liver and the gallbladder, draining into the lymph nodes. And these are not generally removed when a gallbladder is removed just for gallstones. And for this completeness, if the stage of the cancer is T2 or greater, meaning a more vertical infiltration into the gallbladder itself, and in that case another full operation is required, as I've just detailed in previously. So this should clarify to some patients who may feel that they do not need another operation because seemingly the cancer has been removed. It's only the very early T1 stage where it is only present just in the surface when a second operation is not required. Okay, let's delve a little bit deeper into the treatment itself. Say the patient was operable and an operation has been performed, and the patient has recovered. The recovery from the operation is usually quite good, and this operation has a good success rate. Now, further treatment such as chemotherapy will be required for most patients, and it is dependent on a number of factors that are looked at when the tumor is removed and examined under a microscope. Importantly, the T stage, how far does the tumor infiltrate, how aggressive is the tumor, and very importantly, whether or not it has involved the lymph nodes. Involvement of the lymph nodes, unfortunately, is a poor prognostic marker. Chemotherapy will be offered for such patients if they are fit to undergo that. So thus far I've talked about patients in whom an operation was possible. Unfortunately, a large number of patients are inoperable at the time of presentation because it's an indolent cancer and does not cause very many symptoms until too late. In this situation, keeping the patients free of symptoms and at times chemotherapy may be offered to prolong life. This set of patients can do well for a period of time, even with simple measures. This completes the talk on gallbladder cancer. I hope you have found this useful. If you have any comments, please do feel free to write in the space below.